The Patient Protection and Affordable Care Act, also known as Obamacare, is a law that was passed in 2010. It was the most significant reform of the healthcare system since Medicare.
And we have now just enshrined, as soon as I sign this bill, the core principle that everybody should have some basic security when it comes to their health care.
What year are you? What is your major?
I'm a junior, and I'm an international comparative politics major.
Accounting.
A secondary education in history.
Okay, are you familiar with the Affordable Care Act?
Somewhat.
I am not.
Why not?
I've heard of it. I'm not really sure exactly all of the details.
Americans pay by far the most for health insurance, but we are rated 37th in quality by the World Health Organization. That puts us behind Costa Rica. Approximately 44 million people are uninsured in the United States, and this bill aims to decrease that number while also streamlining the healthcare system.
On average, per year, hospitals end up with about $480 million in unpaid hospital bills, and I'll help cut that off because now everyone has to have insurance.
Some of the most important things, us as children under our parents' plans, we can stay on that till we're 26. Before, there was kind of this awkward gap when you got out of college, before you started your career. Like, what do you do for those 2 years?
Are you on your parents' health insurance plan?
I am. And I am on my parents' health insurance.
No. I have my own health care through the university, which, due to Obamacare, doubled last year.
They also can't drop you if you get sick or reduce your coverage if you get sick. Healthcare costs are one of the main causes of bankruptcy in our country, and that's not fair. You shouldn't have to live on the streets because you have a pre-existing condition and you can't afford your insurance, or vice versa. You shouldn't have to forfeit your prescriptions that you need just to keep your house.
Some other important aspects are preventing companies from charging women more than men, tax credits for small businesses that provide health insurance options for their employees, and a public exchange that helps citizens to find a match based on their coverage needs and what they can afford. It also requires insurance companies to cover patients regardless of pre-existing conditions. Critics argue that this bill is a violation of rights and requires citizens to pay for the cost of others. However, the Supreme Court ruled in 2012 that the law is, in fact, constitutional. Furthermore, consider this fact. In America, when people without health insurance have health problems, they go to the emergency room where they are treated. Those expenses are absorbed by the hospitals, which are then passed on to the insurance companies, which are then paid for by charging higher rates to those who do buy health insurance. However, emergency room care is at least 3 times as expensive as primary care. In addition, primary care diagnoses and treats issues before they become more difficult and more expensive to treat. This means that individuals who purchase health insurance are already paying for the uninsured, but at a much higher rate than is necessary. That is why increasing access to primary care actually saves money and increases the social and economic welfare of America as a whole. The bill is not perfect. Some say it is inefficient, and governors have the option of opting out of setting up state exchanges in cooperation with the federal government. For example, Governor McCrory, along with other governors, both refused to set up the state exchange and prevented North Carolina from accepting the federal grant to expand Medicaid, meaning that 500,000 North Carolinians will not be able to enroll in the program. Despite this, however, the Congressional Budget Office found that this legislation will reduce the deficit by $210 billion this decade and by more than $1 trillion in the next decade. On a smaller scale, a family of 4 will save almost $2,300 on their premiums. Because of this law, more than 3 million young adults can now stay on their parents' health insurance until they can purchase their own. More than 17.6 million children with pre-existing conditions can no longer be denied coverage.
I support it. I think that everyone should probably have health care. It's like, you got to have car insurance, why not have health insurance?
I think it's a good policy. I think there's ways around it if you weren't interested in what the government has to offer, but in general, I think it's providing health care to a lot of people who need it and probably wouldn't have it otherwise, like myself.
Despite its flaws, the Affordable Care Act is a positive step towards a healthier society, better economy, and more efficient healthcare system. As with any reform, it is not perfect. but it provides a strong foundation for further healthcare reform as we continue to work for a more effective and comprehensive social welfare system.
We are done.